Let's first start this video with the most interesting fact about our eye. Everyone knows the cornea cover front portion of our eye, and this cornea is the only part of our human body that has no blood supplies. Actually, it's amazing. Literally, I got goosebumps when I know about it.
समझ रहे हो?
So without any wasting of time, let's start our today's video. Have you ever noticed these tiny bright or transparent worms in front of your eye, especially when looking into bright blue light such as sky? These dot or hair-like substance are short-lived, visible for a second or less, and traveling short distances along seemingly random. Some of them follow the same path as predecessors. Also, whenever you try to get a close look, it disappears, only to reappear as soon as you shift your glance. What you are seeing is a common phenomenon known as a floater. The scientific name of these objects is Muscae volitantes. In Latin, these are called flying flies. They may appear as spots, small threads, filaments, or cobwebs, and they are not optically illusion. They are really there, drifting about inside your eye. Floaters may seem to be alive since they move and change shape, but they are not alive. Floaters are tiny objects that cast shadow on the retina, the light sensitive tissue at the back of your eye. They might be bites of tissue, RBCs, and clumps of protein. And because they are suspended within the vitreous humor, the gel-like liquid that fills inside your eye. Floaters drift along with your eye movement and seems to bounce a little when your eyes stop. They become more visible the closer they are to the retina. Moreover, floaters are particularly noticeable when you are looking at the uniform bright surface like blank computer screen, snow, or a sky. Although there are two different virtual phenomena that look similar to floater but is in fact unrelated. If you experience some tiny dots of light darting about when you're looking at a bright blue sky, you have experienced what is known as blue field entoptic phenomenon. The dots are white blood cell or WBCs moving in the capillaries in front of the retina on your eye. These WBCs, commonly known as leukocytes, can be so large that they nearly filling a capillary, causing plasma space to open in front of them. Due to the space, and the white blood cells are both transparent to blue light than red blood cells normally present in capillaries. We see a moving dots of light whenever this happens. Under ideal viewing conditions, you might even see what looks like a dark tail following the dot. Moreover, the another kind of virtual phenomenon is posterior vitreous detachment or PVD. These little floaters can actually be quite large and very bothersome and can even obstruct vision. In the another word, when the vitreous gel pull away from the retina is known as PVD. Usually, the vitreous is normally attached to the retina in the back of your eye. The age plays a crucial role in PVD. Actually, as we age, this vitreous changes. It becomes less solid and more liquid-like. The vitreous is attached to retina by millions of microscopic fibers. When enough of these fibers break, the vitreous separate completely from retina and cause a phenomenon called posterior vitreous detachment. Hence, a person suffering from this phenomenon has to face large floaters that interface with vision, may be sign of more serious condition requiring immediate medical treatment. If I talk about the treatment, then there is no specific treatment is needed for PVD. The complications of PVD are rare but can be serious and require urgent treatment such as laser for retinal tear or surgery. What do you think about it? Go ahead, comment and connect in the section below. And thanks for watching. If you got value out of this video in any way, hit like button for me and share with your friend and relative. Otherwise, keep an eye on and I will talk you soon.